Hi, I'm Dr. Bonnie Higgins, and we'll continue on studying about the concept analysis diagram. And now we will actually talk about a real concept rather than just the blank concept as we covered in the other brief video. We will cover elimination, and I have chosen elimination because this is something, no matter how much nursing you've had, or if you've not had any nursing education at all, I believe that you can relate to this very readily. As you notice that in the middle is the definition of elimination, and it says the excretion of waste products from the kidneys and intestines. Then if you'll notice over to the side, as we discussed before, the antecedents, again, ante meaning before, that before elimination, the concept of elimination can function optimally. There has to be, the patient needs to be continent. They need to have bowel ability to expel feces, and to do that they would have normal peristalsis, which is the action of the bowel. Their bladder would need to have the ability to void, and they would need to have adequate hydration and intake. All these things must be in place in order for elimination to occur. If elimination is occurring optimally, then we would expect to be able to measure certain attributes. And these would be, in this case of elimination, routine voluntary passage of formed stool with urge to defecate at routine intervals, the bladder voluntary control passage of urine. The adult should void 30 to 50 milliliters per hour, and the child 1 to 2 milliliters per kilogram per hour, and there should be homeostasis. So if the nursing care, which is intermittent as designated by the dashes in the arrow, if the nurse, he or she assesses the patient and finds that, say, the adult is only having 15 milliliters per hour, then they would know that the concept of elimination is not functioning optimally. They would expect then that there would probably be some consequences that were negative. These negative consequences could include diarrhea, and from the diarrhea they might have skin excoriation and breakdown. Another one might occur would be incontinence of urine and feces, which again could cause skin excoriation and breakdown. They may have urinary retention, or they may have constipation, impaction, or even bowel obstruction. However, if the nurse assesses the attributes and they are indeed putting out the expected or the hoped for amount of milliliters per hour, then the nurse would expect to find positive consequences, which would lead to homeostasis. When homeostasis leads to positive physiological growth and development. Other positive consequences could be an active lifestyle. They're not restricted for fear that they will have an accident when they go out, or fear that they cannot find a bathroom. Another positive consequence would be positive socialization. They're able to relax and interact without always worrying about the bathroom. Positive self-esteem and nourishment. And so we would definitely expect consequences, as we mentioned, but whether they're positive or negative depends on the antecedents. Ultimately, are these functioning properly? Are they in place so that the concept can indeed function properly, and therefore the attributes which are appropriate that we anticipate would occur? Impacting the concept of elimination are other interrelated concepts. The arrow again is going both ways because the interrelated concepts may impact elimination and elimination may impact them. As we look at the ones that are listed on this diagram, we will see nutrition. Of course, nutrition impacts elimination because if they eat roughage, they're more likely to have a bowel movement if they are not. However, we know that elimination also affects nutrition because if they are constipated and they may lose their appetite, and therefore it affects nutrition. They also may, if they have diarrhea, they might have be afraid to eat, and therefore it would limit their nutrition. Another interrelated concept is that of coping. Coping, we know that some people, whenever they're very anxious and they're having trouble coping with what is happening, that they have a problem with elimination because it increases peristalsis, and therefore they have more frequent passage of stool than is what would be normal for them. Another interrelated concept is fluid and electrolyte balance. We certainly know that if a person has diarrhea, that it affects their electrolytes, and we're very concerned about making sure and having to replace their electrolytes. Mobility, we know that mobility impacts elimination because if a patient is immobile, then their peristalsis is decreased, and therefore their evacuation of feces is decreased. We know that cognition, if a patient doesn't understand the correct things to eat or even to how to take care of themselves if they're having an elimination problem, or if they're not, that it does affect elimination as well. The sub-concepts that are listed with the straight line, again, these are really the things that would be covered whenever a lecture, or not lecture, I'm sorry, but a class is covered on elimination. Physiological development and function would need to be covered, bowel and bladder toileting habits, including culture issues, genetic, gender, age, congenital defects occur, nutritional and fluid and electrolytes. Those would need to be covered, as well as medication and diversions as well, meaning continent diversions. So this is a big picture of all that goes on with the concept of elimination. Now let's go back to what we mentioned earlier. Let's say that we're having negative consequences. If we have negative consequences, the first thing that we would do is to go back and look at the antecedents. What's been compromised? Do they have an adequate hydration? Are they taking in an appropriate diet? Is there some reason why their bladder has the inability to void? Is there no peristalsis? Are they incontinent? What is the problem and what is causing this? So from that, we would decide and we would analyze what would be the appropriate nursing actions to intervene for this. Okay, as we look at the nursing interventions, there's an analysis piece that is vital. If we came over here and we looked at skin excoriation and we treated the patient for the skin excoriation, but we didn't go back and look at what is the problem, then we would simply be doing, as they say, putting a Band-Aid on a hemorrhaging patient, which is not going to help. They're going to continue with their problem, and therefore we've got to go back and look at the origination of the source of the concept itself. We also have to look at the interrelated concepts. Is one of these causing the problem? Is it contributing? Is it impacting the elimination concept and thus making it vulnerable? And what are the attributes? Something should be showing up. Sometimes you have an attribute that shows up that is lacking, and you catch it early enough that you actually do not visually see a negative consequence. So always you are constantly assessing formally and informally as you are discussing with the patient. But the whole goal of your intervention is to strengthen the antecedents. Now each person is different, so as mentioned, the interrelated concepts will be different and the focus will be different. So next we're going to look at two patients who both are involved with the elimination concept, but they're a little bit different in the variation of what's going on with them. Say a 32-year-old man has Crohn's disease with liquid diarrhea. It doesn't matter whether you know what Crohn's disease or not, the description will get you all you need to know. This person has liquid diarrhea 10 times a day. He has an excoriated rectal area and is very weak. His sodium and potassium are below normal range. He is very angry and tearful after each diarrheal episode, especially when he is unable to control his bowels. Just taking that information right there, we can look at the diagram that will be coming up is going to be the identical diagram to what you have seen earlier, totally the same. But if you'll notice, this person has liquid diarrhea, an excoriated rectal area, sodium and potassium are below normal range. Therefore, we've got an electrolyte balance problem. He is very angry and he's tearful after each diarrheal episode. He's having trouble coping. And then his nutrition is definitely affected because of his diarrhea, and if he eats something, then he has a problem with an episode of diarrhea. So when we're looking at what is the problem, we look at his antecedents. And his antecedents, again, remember, they're before the concept occurs. He's not continent. He is having an inability to not to expel feces. He cannot hold the feces. And he is having a problem with adequate hydration and intake. So we know automatically that our nursing care is going to be geared to these two things. So if we're looking at and going up just reading this patient nursing intervention will be geared to helping him attain continence and adequate hydration and intake. In the meantime, he does not have homeostasis. So when we're assessing him, we would notice that there would be a homeostasis because he mentions about the electrolyte problem. He is having trouble coping, and his diarrhea may be due to his nutritional intake. Sorry about that right there. Or it may be affected by his lack of intake. Many times people will not take something in for fear that they will be incontinent. So the interrelated concepts would definitely be addressed when implementing nursing care. And so we would notice on this patient that he has incontinence of feces, skin excoriation, and diarrhea. Now we'll go to another patient, and it's again the identical diagram is used, and what you will notice is that this patient has a totally different and yet the same problem. And this time we're talking about a confused elderly patient who does not like to drink, has limited mobility, is confused, and has not had a bowel movement in 5 days. So we're looking at a person who does not have routine voluntary passage. So when we assess her, we see that there's a problem. She doesn't have routine intervals of passage of bowel. She's not drinking, so she has limited hydration, and she's not expelling her feces. So the nutrition is a problem for her, interrelated, just like it was for him, but for a different reason. She's not drinking. And her mobility is a problem, whereas for the 32-year-old, if he were very active, that would be a problem because it would increase his peristalsis even more. So this is a definite difference. Cognition. Cognition is a problem for her because she is confused and elderly, and therefore if we wanted to talk with her about what would be a good diet, or that she needs to drink more because she needs to hydrate and so that the stool is not so hard, she would have trouble comprehending that. So when we're looking at nursing interventions for her, we will have to look at the manner in which we teach her and how to remind her. And is it that a nurse couldn't just talk with her, but a nurse would need to go in and offer fluid on frequent intervals? This patient, when we look at her negative consequences, we see that she has constipation and possibly impaction, where she doesn't have skin breakdown, she doesn't have incontinence, she doesn't have urinary retention. So she presents totally different, and yet it's the exact same concept, but with different interrelated concepts kicking in. And with the patient, if we look at this patient as their self, then we address her in a very unique manner. So summarizing again for this patient's nursing care will be directly increasing her hydration to promote defecation. But the interrelated concepts will have to be addressed as well. Does she need roughage in her diet? Does she need to ambulate to increase peristalsis? Is she able to understand when she is asked to drink more fluids? And so if we implemented these things that we are saying, then we would go back, the nurse would go back, and they would reassess whether is the patient getting adequate hydration. And then they would measure whether this was successful or not based on is there routine voluntary passage of formed stool with the urge to defecate at routine intervals. And then they would notice, is the constipation gone? And the strength would lie in the use of the interrelated concepts that makes this the individual patient's plan of care in taking care of her. For the man who is 32 years old, the same would be done. How do we strengthen? How do we help him become continent? And how do we make sure that he is hydrated and that he has appropriate intake so that when we measure and assess, his homeostasis will be okay and that he will have a routine passage of stool. Again, personalizing it. But both of these is the exact same analysis that occurs here. The faculty has created 43 concept analyses for your use, and you will have access to them as you study through the curriculum. Each of these can be applied directly to your patient, just as this was shown. You can take it to clinical, you can use it and make it real. We don't want theory to be a textbook that's dead. We want it to be alive and living. So the application of this information is what helps you to give patient care that is prioritized for that patient. It also helps you to look at, when you're looking at the diagram and you see the antecedents, that tells you what must be in place. That's your A and P. So when you're looking and reading in a textbook, you can open and say, what makes elimination good? What makes it well? And this would give you your guidance on your analysis diagram. And what do I need to assess? You know, we talk about the nursing process a lot, but sometimes a student nor a nurse knows exactly, well, what do I assess in this patient? How do I know this patient is normal? What are the key assessment issues? And if you look at the attributes with each concept, that will be your tool and your guidance to looking and determining if the patient is functioning optimally. And by looking at the interrelated concepts, that's how you personalize your nursing care. But first you have to know these things about the patient, and you do that by attaining their history through records or through talking with them or through the nurse's report, which is why it's very important for you to know and to give and to hear a good report on your patient so that you can begin where they really are. Sometimes you find that the chart, electronic though it might be, is not up to date. Maybe there's a diagnosis that is there. It's a medical diagnosis and you think that's what the patient has, but that's really not what the patient has. They've moved on from there. So this helps you keep it current and keep it real. So I wish you luck in using this, and I pray that you will personalize the care that you give your patient. This is a lead-in to the nursing interventions. We have nursing care listed at the top of the diagram, but the thing is, now we have given you how to go about finding what are the nursing interventions that should work for this patient. So what maybe your instructor might ask that you highlight the diagram to make it personal for your patient, just like I highlighted the other two patients. And then may ask you to attach interventions that you feel are appropriate, and how would you know that they were effective, and making them personal for your patient. Or they may have another way for you to show the care that you give for your patients. But we hope that this analysis of the concept will help you, because it's not only an analysis of the concept, it's an analysis of your patient. So my best wishes as you take care of the people that some of us most love in our life. So we want you to be the best that you're able to be, and we hope that this concept analysis will help you. Thanks.